Good morning to all. Today, in the previous classes, we have already discussed related to attitudinal change, which will lead to the uh, changing in health habits or changing in the health behavior. Today we are going to deal with the area that is a cognitive behavioral approach towards health behavioral change or health behavior change or habits. So how cognitive behavior approach is being helpful in the area of changing the health behavior. So we know that from the topic it is very clear that there is something happen with the cognition, so that will lead to the behavioral changes. So this approach is called cognitive behavioral approach, and here you can see that the major some of the therapies or restructuring the mind or restructuring the cognition, which will make the changes in behavioral pattern. So here you can see some of the method or therapies that will approach or that will lead to modification of behavior. So the first one is the first one is cognitive behavior therapy. So we know that it is a therapeutic method or like changing the cognition, or it is an approach related to restructuring the cognition. That is cognitive behavioral approach to health habit modification focus on the target behavior itself, the condition that elicit and maintain it, and the factors that reinforce it. The most effective approach to health habit modification often comes from the cognitive behavior therapy. CBT interventions use several complementary methods to intervene in the modification of a target problem and its context. It can be implemented, that is CBT can be implemented individually. It can be performed, this therapeutic restructuring can be done individually, or it can be done through in a group setting or even on the internet. And so it is a versatile as well as effective way of intervening to modify poor health habits. So it can be this therapeutic restructuring of the cognition that can be done through individually, or it can be performed the group setting, and also can be available or it can be done through the mode of internet. So it will be more effective when to change or to make the changes in the or in the make the changes in poor health habits or poor health behavior, or it leads to change the cognition. The other method that you can see in the case of cognitive behavioral approach, that is the other factor that you can see with the behavioral approach, that is self monitoring. So many programs of cognitive behavioral modification use self monitoring as the first step towards behavioral change. The rationale is that a person must understand the dimensions of the poor health habits before change can begin. So it is a method that the people can do to themselves, that make a self monitoring related to their health and behavioral pattern or behavioral habits, that they have to go for the monitoring by themselves, and that can be considered as the first step towards the behavioral change or modification of the behavior. Thus this cognitive behavioral modification that can also done with a CBT, also there will be the first step can be done with self monitoring. The other factor that you can see with a cognitive behavioral approach, that is a stimulus control. So once the circumstances surrounding the target behavior are well understood, The factors in the environment that maintain poor health habits such as smoking, drinking and overeating can be modified. So once you understand the situations related to the surrounding of the target behavior, so when you understand that the factors in the environment that maintain poor health habits such as smoking or drinking like or overeating, it can also be changed or it can be modified when you understand the stimulus. So stimulus control interventions involve ridding the environment of discriminative stimuli that evoke the problem behavior and creating new discriminative stimuli, signaling that a new response will be reinforced. Here you can find out a example for that, that is the classical conditioning approach to change the alcoholism or the health habits such as smoking, drinking or overeating. Also it can be done or it can be treated through the theory based on the classical condition for modifying the behavior or controlling the stimulus, and that will lead or that will signaling that a new response will be reinforced. The other factor which is related to the cognitive behavioral approach, that is self-reinforcement. So self-reinforcement involves systematically rewarding oneself to increase or decrease the occurrence of a target behavior. That we know that we will be going for making the reinforcement that to strengthen the behavior. Here self-reinforcement involves systematically rewarding oneself, he himself or she herself, to do to make the rewards to increase or to decrease the occurrence of a expected or targeted behavior. So positive self-reward involves rewarding oneself with something desirable after successful modification of a target behavior, such as going to a movie following successful weight loss. So that is a positive self-reward involves he himself rewarding something that is happened after successful modification of the behavior. That is an example it is given that he himself going for a movie after getting a result of weight loss. So that is giving a positive self reward, that is going for a movie related to the modification which is happened with the target behavior or with the desirable behavior. And the negative self reward involves removing an aversive factor in the environment after success. The negative self reward involves removing an aversive factor in the environment after successful modification of the target behavior. So that is the negative self reward. So that is removing something or aversive factor which is making trouble in the environment, from the environment after making a modification to the target behavior. As like self reward or self reinforcement that we discussed in the previous slide, as like self punishment is the other factor. That is, self punishment is of two types: positive self punishment and negative self punishment. Positive self punishment involves the administration of an unpleasant stimulus to punish an undesirable behavior. So you are administering or we are administering an unpleasant stimulus to avoid an undesirable, that is, which is not needed, or the behavior which are making problems. So to punish an undesirable behavior. So for example, a person must self administer a mild electric shock each time he or she experiences a desire to smoke. And negative self punishment consists of withdrawing a positive reinforcer in the environment each time an undesirable behavior is being performed. So, for example, you can see that a smoker might rip up money each time he or she has a cigarette that exceeds a predetermined quota. The other factor in the cognitive behavioral approach, that is giving behavioral assignments. So, it is a technique for increasing client involvement in behavioral assignment, that is home practice activities that support the goals of a therapeutic interventions. So, behavioral assignment, that is a technique that given to the client for that they should be involved with the behavioral assignments. That is, they will be giving some of the works related to home practice or some other activities that should support the therapies what the practitioner or the psychologist are advised. So, behavioral assignments are designed to provide continuity in the treatment of a behavior problem. So, why these behavioral assignments are given to the client? That just because it should get a continuity in the treatment of a behavioral problems. So, for example, if an early session with an obese client involved training in self-monitoring, the client would be encouraged to keep a log of his eating behavior, including the circumstances in which it occurred. So, if a client comes with a case of obese to the psychologist, so they had given the behavioral assignment as self-monitoring. That is the behavioral assignment that has given to the client by the psychologist, and the client would be encouraged to keep a log for this behavior, that is his eating behavior. So, how it is being happened, including what are the situations it should be happened. So, this will help the client, as well as it will help the psychologist to get a continuity in the treatment of a behavioral problem.